Capgras syndrome, also called delusion of doubles, is one of the most fascinating neurological disorders. Just like the name delusion of doubles suggests, people with Capgras syndrome have the false belief that someone they know has been replaced by an identical duplicate or an imposter. People who have this syndrome are convinced that a significant person in their life, like a loved one or a close friend, is not who they say they are and have been replaced by a look-alike. This syndrome results from damage to the bifrontal, right limbic and temporal regions of the brain. Particularly the areas associated with facial recognition and emotional information processing are affected. This disruption in facial and emotional recognition leads to a scenario where the patient recognizes a loved one but fails to feel the automatic emotional response to that person, making them feel as if something is not quite right. Since the individual can be facially recognized, but the associated feeling of love and familiarity associated with that person is absent, the brain fills in the information deficit by coming up with a plausible conclusion that the person has been replaced by an imposter. Scientists believe that there is also an impairment in reasoning associated with the disorder, although a specific impairment has not yet been identified. Studies are still ongoing to uncover the mysteries underlying Capgras delusion, but it remains one of the most interesting disorders of the brain.